All right, good evening, everybody. Welcome to the Coronavirus Update Show. My name is Omari, Salisbury, joined by producer Nikki, Barron. How are you today?
I'm good. I'm good. It just started snowing.
Sorry, Snow. Now, what part of town are you in?
I'm in Skyway. I'm out here up on a hill.
I was about to say you got higher elevation. I don't think it's snowing downtown. Looks like it's still rain here. So, you
Yeah.
know, for Seattle people, we know that uh, if it's snowing and it doesn't snow downtown, because we're right here at sea level and everything, then man, things will probably be okay. But when it starts sticking downtown, then the rest of the area, it's a done deal. So we'll keep an eye out for that.
Yeah. I live at the end of like a long gravel drive too. That's like an incline. So pretty much it works in my favor that I'm already working from home because I wouldn't be
I was
able to
about to
get out of the
say.
driveway anyway with with the truck that I have right now. So
Get you. Your home setup is working out well for you, huh?
yeah, it worked out perfectly.
All right. So we got a lot of stuff going on as usual in the world of coronavirus. First things first, though, as usual, let's get into the numbers.
Yeah, absolutely. So our numbers today, since this morning when we did the numbers on the morning update show, we confirmed an additional 3,949 cases, bringing us to 218,415 cases in Washington state. Hospitalizations rose by 124 and two deaths since then. Then we have our readiness numbers, and this is some good news. Our readiness numbers, normally we want to keep that under 80. It was at 84.5 this morning when they published the numbers. They just did the update at 4:30, and we dropped down to 79.4. I have a feeling that this is going to be a roller coaster of emotions, kind of above the line, below the line, above the line. Until things definitely level out from people taking extra precautions and staying home more than we were, early fall, late summer.
Right. And I talked about it briefly this morning on the morning update show in the Seattle Times. They had an article that said that actually Eastern Washington per capita, their numbers are way higher than over here in Western Washington, especially here in King County. I know you did some follow up on that.
Yeah, I did. And I was able to find the chart that they used in the article that kind of goes over the state and this line that, we here, if you're familiar with Washington, you kind of know that it changes quite a bit as far as political leanings and the makeup of the population when you go across the Cascades. So if you look at, where we're located at in King County, it's 42.8 is the number that they've given there, which is deaths per 100,000 residents, if I'm reading that correctly. But if you look at other places like Yakima, it's 118.9, Grant, 72.9, Adams, 78.2. And so, even Spokane, 58.9. And in the article, the Seattle Times kind of investigated what was contributing to this difference. And they found that it was mask wearing is definitely the number one thing. It's such a political hot button issue for conservatives to not wear the masks. So a lot of people aren't wearing masks. And then a lot of people aren't listening and complying with the stay-at-home orders. They were able to actually trace 16 deaths in a elder care facility because staff from that elder care facility attended a wedding in Grant County that had over 300 people in attendance. So there's a lot of that kind of behavior. So it's all behavior driven. There's no scientific reason why they have more deaths other than they're just choosing to not comply with stay-at-home orders and mask mandates.
Right. And also, I wanted to point out something as well. In a lot of the conversations that I've been having with people, some people who don't want to wear masks and things like that. And, a lot of times we might tend to think that, okay, well, these are right wing or conservative or Trumpers or something like that. But there's also just a lot of people who just don't like the government telling them what to do. They aren't necessarily aligned with, a political affiliation. It's just more like, I mean, and we find that a lot in a lot of the Western states, and really kind of throughout the country, but in different pockets. So it isn't just confined to a political ideology of Republican or Democrat, or you're for Trump so you don't want to wear a mask, or you're for Biden so you do. There is a pocket of people who just aren't okay in any situation with the government telling them what they can and cannot do. So that's another aspect right there as well.
Right, but you can look at the numbers of where people voted. So Grant County, 66% of Grant County voters voted for Donald Trump. And they also happen to have the highest case of people who are dying from COVID. So I know correlation is not causation, but that's a pretty stark line you can draw. It's a pretty thick line there. When you look at the counties that have the highest rate of people who identify as conservative or Republican, they're also the ones that have the highest rates of COVID.
Real interesting. Real interesting. I just want to put this back up here real quick.
Yeah.
Man.
So,
this is wild. Eastern Washington, 69.1 deaths per 100,000 residents. And Western Washington, I mean, it's more than double on east of the Cascades as far as deaths per 100,000. I mean, that's wild. And if you were to just take out one county, if you were to take two counties out from each side, it's like, man, it seems like, well, let me ask you this then. I know we move on. We got a guest here. Well, we had a guest here. Looks like he might be logging back in.
He told me where he lives, the internet can be a little finicky, so he'll probably have to just relog in.
Well, let me ask you this, and I don't know if it mentioned that in the Seattle Times article, but I mean, here in King County and in Western Washington, we have the majority of the beds, we have the majority of the population, and we have the ICUs and all of these other kinds of things. With these numbers at double the death rate in Eastern Washington, is part of that high death rate to do with the lack of medical?
Yeah, it does. Not only do they have a smaller amount of beds, they've also, since they had to stop doing elective surgeries, one hospital reported that revenues fell by $15 million so far this year. So not only do they not have the space for people, they've had to cut hours and cut pay of these frontline workers who are actually working in the hospitals. So yeah, it's a combination of both.
All right, before we take a short break here, you can tell everybody about our guest and what they can expect on the other side of the break.
Yeah, so our guest today is Steve Hickey. He's an EMT, a firefighter, and an independent photojournalist that has contributed a few stories to us around the protest. But he actually got his vaccine, and he told me he was really surprised that he got tapped so early. But as an EMT, a lot of the calls that he responds to are actually COVID related, or things like, so he has, essentially he needs this vaccine to be able to do his job safely. And yeah, we're going to talk to him a little bit about what it's been like to be on the front lines as an EMT here in Seattle, as well as he put together a little clip where he gets the shot. So you actually get to see him go through the process of agreeing to everything, getting the shot, the whole process from getting done.
Right. And Steve also contributed some great drone footage to us back when there was all that smoke in Seattle.
Yeah, that was pretty cool.
We're going to take a short break. When we come back, we got Steve Hickey. You're watching the Coronavirus Update Show. Welcome back. Coronavirus Update Show. My name is Omari Salisbury, joined by producer Nikki Barron. And Nikki, I'll let you introduce our guest.
Hi, Steve. How are you?
Good. How are you guys?
We're doing good. So, why don't we start off this conversation today and tell us a little bit about, what you do? EMT, firefighter, independent photojournalist. Give us the lowdown on all things Steve Hickey.
Sure. So I live out in a small town outside of Maple Valley, and so we have our fire department consists of a respond from home group. So if you call 911, anything from trauma to medical, that call is going to start off with somebody like me showing up at your door, and then it'll go from there. We have a little bit of a unique system out here in King County that's comprised of EMTs and medics, where a lot of areas in the country are heavy on medics. We have more EMTs out here that do everything outside of intubation and medications. And so we've been not getting as many calls as other parts of King County out here, but we get a lot of ones where there's a concern of it. And so PPE all the time. And is it coming through sound-wise okay?
Yeah, we can hear you.
Okay, good. So, as we were getting closer towards this vaccine, it wasn't clear whether or not we were going to be receiving those ourselves. It was going to start out with the high-risk community to begin with, and then there were conversations around getting some of the first responders. So firefighters, current firefighter only doesn't count yet, but if you are a firefighter and have the EMT certification, then you do qualify. And so I got notified Thursday of last week that come on in, and they're basically set aside a certain amount of these for EMTs and medics up till this coming Thursday. And then at this coming Thursday, they're going to start really focusing more on the high-risk categories of the general public. So when I scheduled up to go in Sunday, it was a spot in Tukwila. Brought basically my ID, some of the paperwork from the department, drive on up, and that morning they switched to a drive-through model where a lot of the pictures you're seeing on TV are people going into a building, sitting down. It's a kind of a big ordeal. Now it's very similar to testing. You pull up, you'll see in the video kind of how that goes, and basically you never get out of the car. And then there's a monitoring process afterwards where you sit in a waiting parking lot for about 15 minutes. They monitor everything, make sure that you're not going to have any adverse reactions, and then on the road you go. I was in and out of there within 30 minutes, and that was from the waiting line to the observation area and back on the.
Oh, looks like we
lost them, but we'll go ahead and play the video that he's talking about. Here we go.
As you probably know, you are getting your first vaccine today.
Yes.
You are getting the Pfizer vaccine, meaning in 21 days you also need to get the Pfizer vaccine.
Okay.
You'll be getting more information about that for signing up and everything.
Okay.
We're going to be injecting your left arm because you're on our left side. The biggest side effect we see is just a little bit of soreness in your arm. Moving it around like this is going to help it go away faster. We're also going to be monitoring you over here for 15 minutes, just to make sure nothing happens. And they're here to help you out if you have other questions. Okay, and can I have you open your car door for
Yeah, of course.
Get your arm a little easier.
Okay.
And roll up your sleeve.
Sure. How's that?
Okay, yep, perfect. And just kind of relax your arm there. Just a little bit of hold at first.
Okay.
Okay, slight pinch.
Oh, wow.
Yep,
That's
pretty
completely
easy.
painless, yeah.
And I've gotten you a nice pink Band-Aid.
Okay, great.
And then you can take off whenever you want.
Perfect.
This is
Thank
for
you.
Have a good day.
And then just pull up there?
Yep.
Two.
And so we see Steve goes through the process. That looked pretty quick. I think we got Steve back. Yeah, the man. Hey, Steve. You said you live way out there. I guess you really do, huh?
Yeah, it looks like he's struggling to get his internet together. But yeah, so we talked a little bit about the video earlier, and he was telling me, it didn't hurt at all. His arm's not sore. He didn't turn into a lizard, and he's fine today, 24 hours later after getting his first shot of the vaccine.
Right, right. And now he mentioned something there. He said that first, well, we've been hearing first responders, and then to the most vulnerable population, where we talk about people in maybe senior care homes. Do you know anything, Nikki, about how they're going to roll that out? Because one thing that I heard was that Walgreens and CVS's would be involved, or people, or how is that going to happen? Are they taking the vaccines there to the nursing homes, or
From what I've seen so far, they're taking it to the nursing homes to treat people, but it's kind of different state to state. And so I'm not quite exactly sure. I'm also not sure if we're going to see that rollout as soon as we had probably planned on seeing it, because we were supposed to get a similar amount, about 400,000 vaccines again this week, and we got 40% less than that. So we may not be happening as quickly as we had originally hoped, because nationwide, we're seeing that a lot of promises were not kept from the federal government and task force, who I think they called it what's it called, Project Warp Speed. Getting those vaccines out. So there was a lot of promises that were broken this week to states.
All right. So we'll try Steve one more time. Steve.
Yeah, so I'm more set up for pre-record out here where I live out in the sticks. So we'll try this on the phone though.
I see, and we can see and hear you well. So we played the video there, and it showed you, getting the vaccine and going through the process. What you might know, because you mentioned this, we were just saying, do you know what the plan is now for second phase for people in nursing homes, that vulnerable population of what they're doing? Are they taking the vaccine there to the nursing homes? I know that in some reports they talk about Walgreens and CVS being involved in that process as well. Do you have any insight as to how elders or this vulnerable population is supposed to get the vaccine?
So my understanding is they will be taking it to people in those in those type of homes. The challenge is these have to be kept so cold, right? So that infrastructure is still being built. I mean, what is pretty remarkable about this process is really how far we've come from conception to implementing now. And there's a lot that we don't see. Just that facility I went to really is just a building that's been converted into this kind of on the fly. And as fast as it was all pre-scheduled out. You can only process so many vehicles. So I know that there's been a big push to get more private business involved, whether that be CVS, retail locations, and then getting mobile setups for places where people can't get in there. It's the only way to get something like this done. I don't know the numbers of how many people actually got the vaccine the day I went, but at that pace, even running cars through one after the other, at best, it would be in the hundreds. And we have tens of millions of people to get vaccinated. So it's going to take many different versions and many different ways to get it out there.
Are you feeling any side effects, Steve?
One thing I got, my arm's sore today. So yesterday, if you saw in the video, I'm looking forward. I'm really afraid of needles. And so the reason I'm looking forward is so I don't break out in sweat and look like I'm having some adverse reaction. And then it was over. I mean, it was the only needle I've ever had that I didn't feel. So I drove away, went home, feeling totally fine. This morning I woke up kind of like I slept on my arm weird. Nothing that's affecting my day, but it's pretty sore. It's gotten better as the day's gone on. I haven't had anything else. They gave me a list of different side effects to look for. Nothing that scary by itself, but if you are getting those after having the vaccine, that they want you to get back in and get to the hospital or see professionals.
Nikki?
Yeah, so I was actually reading a little bit about the side effects, and most of what doctors are saying is that when they see people get the shot and then have an immediate reaction, it's to what you just said. It's a reaction, a psychological reaction to getting a shot. They were saying that just the way that vaccines work, that you actually can't have an adverse reaction to a vaccine that quickly. It would take a few hours. That's why the people who have had an allergic reaction, they had gotten all the way home, settled into their homes, and then they started to not feel well and had to go back and get treated for that. Nobody was feeling unwell due to an allergic reaction right after it happened. Most of these videos where you see people, a couple of people have fainted, a couple of people get sweaty, turn red. That's all because they're having that psychological reaction to getting a vaccine. But the vaccine doesn't work quick enough to actually make you not feel well immediately.
That's 100%. It's going into a muscle. It's not going into a vein. And somebody like myself, when I've had to have an IV before a surgery, I'm breathing into a bag. I'm having like a breakdown. I'd rather get punched in the face than get poked in the arm. People who kind of have that, it's just how it is. So, and I think a lot of these concerns and the documentation about these reactions, it's an abundance of caution. Given the climate right now and how people are responding to this, they're really going above and beyond to address these. And that in itself can make people feel like there's something more there's more to be concerned about than there is, because they're trying to address those concerns so well.
Yeah, I mean, I've seen my dad when he was in the military get the anthrax vaccine. He's had all kinds of crazy vaccines being in the military and getting deployed. And I saw him have some pretty gnarly reactions, his whole arm swelling up in a rash. And they're like, oh, yeah, that's totally normal. Like, that's just what happens with some vaccines. And so it's nice to see that for every instance that something like this is coming out, there's a lot of doctors coming out being like, no, this is what's actually happening in a way that we've never really seen before. A lot of people have these similar reactions to the flu shot, but you don't, there's not like viral videos going around like, look, an adverse reaction to the flu shot. But this is just so new and so scary that there's definitely a culture of fear, I think, around it. So it's nice to see, like you said, people coming out and speaking in support of it.
Yeah,
Steve, when we see you in downtown Seattle or Capitol Hill, and there's kind of a different idea about the vaccine and even masks out here. But when you're home, you're out there in rural King County. What are some of your neighbors' thoughts about masks, and what are some of your neighbors' thoughts about the vaccine?
Yeah, it's hit and miss, and I think to Nikki's point about feeling that there's a political element. I think that's true. But I think masks and vaccine, even themselves, kind of have their own tribes. What I found is somebody who doesn't want to wear the mask, it's a statement, right? When you don't want to have the vaccine, I feel it's a little bit different. It's deeper. It's a bigger concern to get over, because I think the mask, as you're saying, it's them just saying, I don't want to conform and I don't want to do what somebody's telling me. And yeah, it just so happens they do seem to vote a certain kind of way. But on the vaccine side, I think that distrust, I'm finding more of that in the city than I am out here, actually. And maybe that's because out here, they're really not even concerned about taking it for some time. They think it's going to work itself out. So I don't know if as much as it's how they feel about the vaccine, just it's not as big of a concern. The amount of messages I've received, whether that be texts or through Facebook after I posted some pictures, was pretty wild. And it was people who I thought were going to be more receptive to the vaccine or hitting me up saying, no, tell them, like, really what's going on with this and should I take it? And they're wearing masks. So I think there's some other levels going on.
Easy. Yeah, this is what I'm saying is that there's a lot of different layers. I mean, there's people in my neighborhood in the Central District who are 100%, they're mask all day long. Everything's masked up, PPE. But 100%, they're saying that they're not going to take the vaccine just because over trust issues and everything else. So I think this is a difficult issue to kind of paint with a broad brush. It's all kinds of different people, either mask and vaccine, no mask vaccine, no mask, no vaccine. We'll see what happens.
Yeah, I'm hoping with time, as people start seeing others take it, not getting adverse reactions, they get there. It's amazing the stuff we will put in our bodies, whether that be processed food or whatever else, with no concern, and feel like, well, it's statistically fine, and then feel like you want to minimize the concern of coronavirus as if that statistically is insignificant. It seems like everybody wants to use the stats however they want, depending on what they're talking about.
Yeah, like there's that meme going around where it's like, if coronavirus came like this, nobody would have a problem with it. It's like a vape cartridge. And you're like, oh yeah, like definitely makes sense. Like, people who are smokers who know on the package, it says like, this will kill you, this will cause these problems, and they're fine with it. But this vaccine that they're saying, actually none of it doesn't really have any adverse side effects. People are pretty skeptical. And there are people, I believe, that have a legitimate reason to be skeptical. But some of the conversations I have with people, I'm a little bit like, I've seen you put very experimental things in your body, and you're afraid of a vaccine that's, could save your life. And, hundreds of thousands of people have had it at this point. So, yeah, it's an interesting conversation.
Yeah. I didn't catch much of that.
Steve,
I got to the end.
No, don't worry, Steve. Thanks for joining us, and we're going to catch back up with you in 1 month when you go for your second shot.
Sounds good. And I'll send you some of like the vaccine card I got. There's a card I have now that I'll send over. You guys can show everybody, and we'll go from there.
All right, Steve. Thank you.
Thank you. Bye.
Well, I guess we know somebody who got the vaccine now.
Yeah, he looks okay to me. And I'm glad to see that he got it. I'm glad to hear that EMTs are getting it, because as these hospitalizations increase, we're going to see an increase in people getting to the hospital via ambulances and through people like Medic One.
Right. All right. So tell us, what do we got on tap for Wednesday, Coronavirus Update Show?
Yeah, so Wednesday, it's my birthday actually. So Wednesday, we're just going to have a conversation kind of about headlines, what it's been like this year so far, what it's like to be a part of the media. So it's just a conversation between you and me.
Well, that's good. We'll see who else we can sneak in. All right. Well, appreciate you as usual, Nikki. Thank you for staying on top of this, staying on top of the numbers, and man, digging through all these bad stories. You know what I'm saying? But
yeah.
I mean, it's important that we have these discussions and have an open discussion. So, thanks.
Thank you.
All right, everybody. So we're back again in Coronavirus Update Show on Wednesday at 6:15. You can catch me and Nikki Barron live tomorrow morning on the Morning Update Show. Until then, peace.
Peace.